Thank you so much for the introduction, and thank you everybody for coming today. I'm just going to start my screen, my slides. So today I'm going to speak to you about students' mental health in the engineering faculty at U of T, online learning and COVID-19. So I'm going to go over some context and background. I'm going to speak about how online learning impacted mental health during the pandemic, and how students' perception of online learning also influenced their mental health and their reaction to online learning, some pedagogical approaches that could improve what students told us they liked and improve their learning, and then the Q&A. So we weren't alone in moving to online learning, and this was, I've just got the Canadian slide here, but all around the world, post-secondary education moved online. So, we had 92% in Canada, and a lot of work placements were delayed or cancelled too, which had a significant impact on our students as well. The context for the research I'm going to speak about today is this was begun as a quality improvement exercise within engineering, led by the mouthful ISTEP. So data was collected through surveys and focus groups. I'm going to focus on 2 surveys that we did with students, but we also interviewed, surveyed faculty as well, but I'm not going to cover that today. My personal research was on how students' socialization was impacted by the online environment. And as we were doing that, diving into the data, the impact of social isolation in particular became very evident, and that was very interesting. The team was led by Professor Greg Evans, who's the director of ISTEP, and Dr. Chin Liu, the senior research associate, who I reported to. I'm a PhD candidate in higher ed and a member of the engineering education program, which again is a collaborative program between engineering and OISE, which is the education faculty at University of Toronto. So the data collection took place, we did the transition shortly after the pandemic began. Some of us in the room, I'm sure, remember this weekend, the formal announcement that we were going to switch 100% to online learning was made on March 13th, and we went online March 16th. This was particularly difficult in faculties like engineering, where there is a high hands-on component and a large number of labs that are involved in the curriculum, and also accreditation concerns as well. So, it was a huge effort. We characterized it as an emergency situation, which, switched to, as we all like to say, the new normal. So it was online learning. These surveys were administered in May 20th and December 2020. We got a pretty good response rate on the first one, COVID fatigue and some survey fatigue. I think a lot of students were surveyed many, many times for many different things during this period. So our response rate dropped. People who did respond, though, were engaged. We had both qualitative and quantitative questions, and especially on the first survey, we got a lot of 500-word answers to some of the questions that we asked. So some very, very rich data. So the key takeaway from this is this slide. So in both surveys, we asked our students to self-report on their state of mental health. So the blue is what they responded in May, and then the red is what responded in December. So they were given a scale from their health became much worse to their health became much better. So as you can see, unfortunately, but perhaps not surprisingly, there was a distinct shift to more negative. There were a number of reasons that this happened. I think the 2 that came out most in our data, and this result was not unique to us. Other studies I looked at schools in Canada and also in the UK had that had done this type of work, similar types of findings. For us, it seemed like, at least in the first semester, people had had a chance before switching to online to make relationships within the classroom and with the prof, and that wasn't present in the second. And also just the lockdown and the duration of it definitely increased senses of social isolation, which in turn decreased mental health. And I think, when the previous presentation talked about social belonging, the impact of social isolation on that type of feeling was significant. So this is just a summary. 58% experienced a decline, 40% said the health was either poor or fair. And this situation impacted people who were arguably already at risk. So we're not clinicians, but this was self-reported. So students who said prior to the shift to online learning, their mental health was either poor or fair, were more likely to report a decline. And accommodation services within a U of T context. So this is where a student would go and ask for special report or special support or accommodation on some level. And again, those students were more likely to see a decline in mental health. The caveat is, and Dr. Evans was very strong on this, because we're looking at online learning in a pandemic, it's very difficult to tease those two things apart. So that's a caveat that I ask you to keep in mind when you're looking at these results. Social isolation was a key factor for nearly 40% of students. And interestingly, even though students craved interaction, within U of T, and I also teach at Seneca College, there's a very strong emerging, and I would say emerged norm, that most students keep their cameras off unless they're in small group settings or unless there is like a very strong directive to put them on, which, there's many reasons about that. Other key themes in our data: increased stress, increased workload. We did quite a bit of work to see whether the workload had actually increased or it was perceptions. I think though, because the work itself changed, the way it was delivered and done, it in and of itself felt like more, even if it wasn't. As time went on, increasing reports of screen fatigue and physical impact of online learning, and increased feelings of depression and hopelessness. However, some students really liked the online learning. So it wasn't terrible for everybody or mediocre for everybody. Some students really, really liked it. Some students had a learning preference for online going into the online learning situation. We have a high percentage of commuting students within engineering. So some people commute up to 2 hours each way. And we're right downtown Toronto. So for those students, they sort of got time back in their lives, and most of them really appreciated it and liked the flexibility that online learning gave them. A small number of students, but still not trivial, reported that they actually found coming to campus unnerving. They found being in the large classes difficult, and they preferred the online learning. So, we did have a population that really appreciated this type of learning environment. The perceptions of online learning: we asked students about how they felt the transition to online went. So this is sort of what their expectations were and how it actually transpired. So, for online learning, we can see that over 40% found the actual transition better than they expected, which is an interesting finding. And this was from the May 20 survey. Then we asked them about their impact on learning, and as you can see there, we've got far more people who are negative about the impact. So they either said it had an extremely detrimental or it hurt their learning, and that's nearly 50% there. I didn't put the December on this chart, but in general, it was a similar pattern, but I would say things moved more to the left and were slightly more polarized. So there was still, more people that felt that the impact on learning was detrimental, but there were less people who were neutral about it, which was an interesting result. Something to keep in mind as well when we look at these type of studies is the lack of agency that was involved in the shift to online learning. So students didn't choose this. This was mandated because of public health issues. So there was, before, a lot of the literature talks about the student profile of somebody who chooses to take a completely online degree. And, that would tend to be somebody who was older, who maybe had family responsibilities, that type of, it's a generalization, but, especially in engineering, I would say, especially people in our robotics program were horrified at the thought of doing 100% online work. And also keep in mind, it was mandated for both faculty and staff to move online as well. So that impacted some people's teaching styles. Some people took to it like a duck to water. Some people really struggled with it on both sides of the classroom. And again, it's difficult to pull out the impact of the pandemic, and the personal learning preferences of students played a large part in whether they adjusted well or had challenges. The impact of this manifested in different behaviors. So we'd asked about motivation, class attendance, and also to one of the previous speakers' points about ease of asking questions. So these were we found some of the more interesting findings. People felt less motivated to learn in an online environment, and unfortunately that did decline over time. They attended less classes, but many students found it easier and safer to ask questions in an online environment. So this is something I tried to continue to think about, is using chat to solicit questions, also using discussion boards with anonymous questions. So if you have anonymous questions, there truly is no stupid question, because nobody knows that you're asking it. And a lot of the times people would ask a question and lots of students would say, oh, I'm so glad you asked that question. So there is some social interaction actually within the chat as well. Some of the instructors actually let students answer the questions and would actively police them. Sorry, police them, that's not the right word. Interact with them. And I think that's the key thing with discussion boards that came out, that students like them, but there must be monitored and engagement with instructors and with or with TAs, that if people ask questions, they want a timely response. And if a student gives a wrong answer, that at some point it's corrected gently, but so that students can be confident that they're getting the right information. So some approaches and techniques that we found students reported as being helpful. Everybody loved the recording. Even people that did not like online learning really appreciated lectures that were recorded and posted. The only caveat there being that, as one of the students disarmingly put it in one of the focus groups, the tendency to binge watch and sort of skip classes for a few weeks and then try and catch up. I think there really needs to be something built into the curriculum, or low stakes quizzes, something that makes sure that people are finishing one module before they go on to the next, and that you have some sort of knowledge check so that people aren't tempted to leave them to midterm and then try and get through them all at once. There's also concerns from an instructor perspective, from an intellectual property, that you're creating course content that is then posted publicly and available for everybody. So, this is not a problem-free solution, but from a student perspective, it's amazing. And I would say I'm an instructor and a student, and I've found it amazing too, in terms of being able to go back and review what's been said in class. Also using pre-recorded lectures, that was and sort of switching the classroom into, we're going to go over problems, we're going to do examples. A lot of students really like that. Even though we have a fairly large proportion of international students, holding synchronous real-time classes was very, very popular, which seems counterintuitive, especially for people who are, many time zones away. But what we found that students craved was structure, and real-time classes give structure to the day, to the week. And in an online environment where you're not seeing people outside your house, that structure was very, very helpful, especially for first-year students. Challenges, the whole thing about learning and learning with less interaction. And this is something I really delved into and found interesting. And, Becky was talking about deep and shallow learning. And I think that from what we saw, there was that interaction with students when they're studying together, when they're brainstorming, when they're, did the professor mean this or did they mean that? And they're drilling down, and that sort of informal learning is actually leading to a lot of deep understanding. Final assignments and exams, a very different approach. So exam strategies that work in a real-time environment don't necessarily work in an online environment. A lot of profs in the second semester switched more to projects and open book exams, which were popular with some students. And participation, a lot of people found it very difficult, awkward to participate in an online environment. General recommendations for mental health that came out of our thing. Don't assume that your students know where mental health supports are and how to access them. They might have been taught in orientation week, they've forgotten. I myself try and every couple of weeks just remind people these are available. If you're stressed, if you're having difficulties, it's better to go before you're in crisis mode. If your friends are having problems, just remember these people are here to help you. These resources are here to help you. Keep in mind that as we move back to arguably normal in-person classes, that some people, for various reasons, really like online classes. And, wherever possible, the institutions have already made the investment in creating those online classes, have them available for people, if at all possible, that prefer that. Incorporate some of the techniques into traditional and hybrid courses. So even if we move back to either a hybrid or all classroom, keep those discussion boards, keep those anonymous forums. And a tricky thing to do, but if you are online, be more intentional about informal interaction. I used Weitzman's professional model of socialization for students. And that informal communication tends to be difficult to promote in an online environment. One example I and some of my colleagues have done is after we have an exam, an online exam, we keep the classroom open afterwards and invite students back into it and just discuss and reassure them, yeah, that was a tough section. And no, that's an interesting approach. Don't talk about the answers, but just reassurance. And it also helps the students level set with their peers that if everybody found the exam tough, I'm not terrible for finding it tough. So that's important too. Also, and this came from a lot of international students, the worry about mental health supports that were only offered over the phone, and the worry that family members would overhear or roommates would overhear. So, just offering that support in different formats. The techniques, do the recordings if at all possible, questions on tax, most of what we said discussed prior, but this low stakes online quizzes with the caveat of be careful not to have too many of them, because we switched from, or I personally switched from quite big assignments to multiple smaller ones, but people found the workload like even more difficult to cope with. So that's a hard thing to cope with. And also, some profs don't offer online office hours and let students book in advance. And students really, really appreciate that, that they don't have to come on campus to meet with a prof. So if you're not doing that, then we'd suggest that you think about offering it, because it's very popular with students, with those students anyway. So I'd just like to thank very much Professor Evans and Dr. Liu for giving me the opportunity to do this research and for all their help and support. and the students and staff who really, really helped us gather all of our data for the surveys and focus groups. So thank you all very much.